Lane Rehabilitation Center is a center that is comprised of occupational, physical, and speech therapy, which is made to return patients back to their prior level of function. When we see patients here at Lane Rehab, they either are referred from home or they are referred from a hospital setting. Most common reasons that patients admit to inpatient rehab is stroke, hemorrhage, brain dysfunctions, multiple traumas, joint, whether it's a knee or a hip. We do have multiple arthritis. We have some patients that admit that's on Guillain-Barré. So it's a lot of neurological as well. Once a patient is admitted here to inpatient rehab, the clinical liaisons will visit that patient along with the physical medicine physician that's here at the hospital. When patients are admitted here, they get that team approach of support. And that support comes from the social worker, the liaisons, the family members, the physicians, and nursing staff. On a typical rehab day, which is 8 hours, they would do 3 hours of therapy. And therapy would consist of OT and PT and ST if needed. So a therapy session could last anywhere between 15 to 20 minutes. They will have a rest break in between, and then they'll start the other session, whether it be OT, PT, or ST. We have the physician, which is a PM&R physician, that works with that patient 3 to 5 times a week. And then we have hospital medicine that comes and see the patients at well. So if we need to call in a specialist, we will put it in order for that as well. Another thing that we are starting here at Lane Rehab is Rehab Tracker. Rehab Tracker is a new device. It is on any type of phone or an Android device. And what the patients do is they will sign a consent saying that it's okay to share the information with their loved ones. And once they do that, a patient can track their goals, their progress, and their discharge planning. And then family members can also key back into them and tell them, great job, Mom, you did wonderful. If there is a need for the social worker and or the therapist to go out to a home to do an evaluation to make sure that it's safe, we also provide that as well. But once a patient is discharged home, myself and one of the other liaisons will wait a week and call and follow up on the patient to see how things are going, to see if there's any other needs that they need since they've been at home, because sometimes things do change or their support system change, and they may need an aide to come into the home, or they may need home health when they didn't need it prior to.